We're going to hold the questions until the end as well for our panel. So I'd like to introduce Dr. María Sáenz, who is coming for us from Venezuela, and she's going to be also one of our amazing mentors, and she's going to be talking about global resilience, facing adversity, and triumphing together. So please join me in welcoming Dr. Sáenz.
Hello. Thank you, everybody, for being here. Thanks, GLODERM, for giving us the opportunity to be in this excellent and beautiful program, really. So, to start with this picture, this is Jose, this is Piloto, a Yanomami, and also this is Angie, a girl with dermatomyositis. So, what do we give answers we could give to these patients when there are low resources, low financial problems? We have to give an answer to these patients. Where do we give that answer? In the hospitals, in the public hospitals of Venezuela. So we have to think of dermatology that is more than a cure simple disease. It's an art and a science of healing, restoring not only health, but also the dignity to those suffering from this cutaneous disease. So in Venezuela, we are located in the north part of South America. We are a country of around 28 million people, mostly young people, and we had a terrible crisis, economical crisis in 2013, when the GDP went down 60–70%. So most of our population stays on the north part, and a lot of them left the country because due to the low salaries, due to the lack of facilities, resources. Of course, not only doctors, one-third of physicians left, but also all health personnel, nurses, laboratory personnel, and around 30,000 physicians left the country, and people, of course. We are the highest refugee population, around 8 million Venezuelans, and you can see they are all over the world. But we have a service, we have to keep on going, we have to places where we have to keep educating and training. And this is the Hospital Universitario de Caracas, located in the university campus of the Universidad Central de Venezuela, which is one of the most important universities of the country. As you can see, this is the only service of hospitalization that serves the country, and we see a lot of patients every day, 200 patients. And what could we do as doctors, as 50 years old doctors? We couldn't leave the country. We had to stay to these people, even though our salaries are resources. I mean, they are very, very low. So we have to keep on going with our students of pre-med. We have to keep on going with our specialty, because then the dermatology dies. It dies, finishes. So we have to keep on teaching them not only education and knowledge, we also have to practice with them closely as mentors. And also we have to help our personnel, because they also leave the country, so we have to keep them loving what they do. So we have to sometimes help them with the transportation and help them with the food. That's what we did all those terrible years, because we have to give that human vision of our specialty. No, it's not cosmetic, it's especially that cures, diagnose, treat skin diseases. So as you can see here, we have all the services with our residents, students, and some of the doctors that are still there, and we try to innovate and adapt our therapies. For example, this is a necrolysis, epidermic toxic necrolysis, that we had to use, for example, plantain leaves that we cleaned them, and they use not to stick the skin to the sheet. So that's an innovation, because we didn't have any material to cover the skin of these patients. And our hospital is rounded, but all this marginality around our hospital, that we have to cover all these low-income people that come to this. So, but we need to be visible as a change maker, as a people that need to be there to give them hope, to give them an answer to this disease. So that's what I wanted to always say in my hospital, to the residents that we are more than doctors. We are a person that gives them hope always to these people in order to transform their lives. So this is, we have to try all of the time to overcome our obstacles, because we have to honor those people that all the time heal, that all the time are there to learn, and all the time that believe in medicine as an act of compassion. That's what we see. Sometimes in Venezuela, people say, why don't you leave the hospital? Because you don't need to be there. You don't need to be every day in the hospital and in the morning, 7 a.m. But who is going to be for all these people? Who is going to be to educate, to keep on going with our specialty when there are very strong forces, that against our specialty. So that's a matter of what I wanted to tell you in this conference. And that's Jose, the one that I showed you. He came to our hospital in very bad condition. Nobody would treat him if he wasn't in a dermatology service, because nobody knows. So Jose did very well, and finally he was left out of the hospital in very good condition. So that's what I wanted to tell you, that may dermatology continue to be a beacon of science, empathy, and hope, even in the toughest circumstances, because we have passed through very, you can imagine, circumstances, very bad situations, but we still keep being there for these kind of patients, because most of patients are poor people, in-needed people, that they need an answer to their cutaneous diseases. So I thank you, GLODERM, for letting me be part of this mission, and everybody that was in this group. And I thank you for my mentee, Doreen, that inspired me, because when you see that we believe we are in the worst situation, you can then listen to Solal, listen to Doreen, listen to all these kids that they also have very bad conditions, and they are always hoping that things are going to be better, and that we now have institutions like GLODERM that come from very rich countries, but they want to help. That makes you feel a lot better and let you keep on going, never stop. And that's what I wanted to say. So thank you so much for everything, and thank you, GLODERM, for this opportunity.